Hello, and welcome to Service Above Self, a production of the Rotary Club of Broadbrook, Connecticut, with support from Rotary District 7890. My name is Margaret Byrne, a Rotarian member of the club. I will be your host for this episode. Today we will explore the profession of acupuncture. One of the therapies of traditional Chinese medicine, acupuncture has been practiced more than 2,500 years. Joining me is Carrie Sawtell, LAC, owner and operator of Many Rivers Community Acupuncture, LLC, located in Windsor, Connecticut. Welcome, Carrie.
Thank you for having me, Margaret.
Could you tell us, how did you come to take up the practice of acupuncture?
Well, as a young child, I developed digestive difficulties pretty early on, and there wasn't much at that time that Western medicine could do for me. As I got older, I started looking for things I could do to help myself, and I picked up a book on acupressure, which is when you press or massage the acupuncture points. And I found it to be very effective. So later on, I found an acupuncturist, and even that very first treatment, after the first few needles were inserted, I could feel my stomach and my abdomen relaxing, and I knew I was onto something. I liked it so much that I decided that's what I wanted to do for a living.
Oh, that's wonderful. And where did you learn this art?
So I first did my undergraduate here in Connecticut at Wesleyan University, and then I moved to California, and I started by studying acupressure. So I studied at the Acupressure Institute in Berkeley, and then I went on to get my Master's of Science in Traditional Chinese Medicine in California. Following that, after I graduated, I moved to Shanghai, China, where I completed my postgraduate training at the Shanghai University of Traditional Chinese Medicine.
Is it typical for an acupuncturist to actually study in China?
Unfortunately not. Most of the time people come out of school in a lot of debt and wanted to start up their clinics right away. But my teachers told me, they said, if you don't go right after you graduate, once you have a clinic of your own, you won't have time to go. So I heeded their advice and packed up and moved to China.
Now, how long did that take, that course of study?
Well, I was there for 3.5 years. So I did a number of different things when I was there. I did an advanced acupuncture training course, and then following that I interned in 2 of Shanghai's integrative medicine hospitals, and following that I studied Mandarin. So I was there for a total of 3.5 years, doing a number of different things while I was there.
So you learned the language while you were studying?
I had studied a little bit before going, but I learned a lot more once I was there.
Immersed.
Immersed, exactly.
Now, do you have to pass some kind of a test to become a therapist, or acupuncturist?
Yes. Most of the states in the U.S. Use the national certification standard. It's a national test. Since I went to school in California, they're one of the few states that have their own state exam. So I studied and passed both the California state exam and the national exam.
So you're able to practice anywhere in the United States?
There are a few states that don't allow acupuncture, or it's in the works to have it so that you can become a licensed acupuncturist, but each state has its own laws. For the most part, if you go to an accredited school and pass the national exam, then you can apply for licensure. But each state does have its own individual requirements.
Now, how about Connecticut?
Connecticut just requires you to go to a certified school, an accredited school. You have to meet a minimum number of hours, and that's what the accreditation makes sure that the school has, and then sit for the national exam.
Okay. Now, you have a designation of LAC after your name. What does that mean?
That means licensed acupuncturist, and that's the designation that most of the states utilize. There are a few states that have different designations. Some, I think, will allow you to utilize a designation doctor, but for the most part, it is licensed acupuncturist, or LAC.
Are you a doctor?
No, I'm not. There are a few states like California where acupuncturists are considered primary care providers, but in Connecticut, I'm just a licensed acupuncturist.
Interesting. Now, has the practice of acupuncture changed over the 2,500 years?
Surprisingly not. In fact, one of the main textbooks we utilize is from about 2,000 years ago.
Really?
Now, of course, our diseases have changed, and our understanding of the human body and the disease process has changed tremendously over that time. But when Chinese medicine was developed, It was developed not only as a system of acupuncture, but as a way of diagnosing disease. And so we utilize the signs and symptoms of what's going on in the patient to come up with a disease diagnosis. That disease diagnosis process is essentially the same as it was 2,000 years ago. For example, many women nowadays suffer from menopausal symptoms. So they have hot flashes and night sweats and maybe some dryness and maybe some difficulty sleeping. Well, that pattern is called yin deficiency, and that was identified thousands of years ago. So we might call it menopause, but it does have an actual pattern that was discovered, and we learned how to treat it thousands of years ago.
So acupuncturists have been treating those types of maladies for years?
Yes.
That's very interesting. Now, how does acupuncture actually work on the body?
Ah, that's the question of the hour, isn't it? We don't have a grand unifying theory of how acupuncture works. We have done a number of studies and we know a few different ways that it works, but it's bigger than that. Some of the things we know are, first and foremost, it changes the way the body perceives pain. And that's why I can put a needle in and immediately your back pain can be reduced. That's the immediate effect. But going forward, acupuncture brings blood flow and reduces inflammation. It has a very strong anti-inflammatory effect. And that's why it's good not just the moment the needle is in, but for days, weeks, even months after that needle was removed to help reduce pain because it fights inflammation.
Are you putting the needle directly into that point of pain?
It depends on what style of acupuncture you practice. There are some styles that prefer to put the needles exactly where you have the pain. There are some styles that believe it's better if you put the needle far away from the pain. The beauty is that they both work.
And what do you practice?
I practice the latter, which is called the balance method. And again, this is based on that text I was telling you about from about 2,000 years ago. So we find that by treating far away from the pain and on the opposite side of the pain, it's actually more effective. And the nice thing about that is, let's say you have back pain, I don't have to put you face down on a table and put needles into your back for you to feel better. And anyone who's had a very acute back spasm knows that the last thing they want is someone putting needles in their back.
So what you're saying is you can put a needle in my hand, my left hand, and it might affect something on the right side of my body?
Exactly. A way that I'm thinking about it lately is that the brain is kind of lazy. And of course, when we're in acupuncture school, we're not talking about how lazy the brain is, but really that's how it is. It gets into habits. And so pain can be a habit. And unfortunately, the body has a pain and it tells the body that it wants to fix it, but over time, if it's not fixed, it just gets stuck there. And so acupuncture works by breaking that habit, breaking that cycle. The other way that the brain is lazy is that it maps the same part of the brain correspond to different parts of the body. So that's how a point in your hand could correspond to your shoulder and also to your back. It's kind of like layers of mapping. So instead of having all these different neural circuits, they use the same neural circuit.
So for every person, this mapping would apply equally?
Yes, exactly.
Okay. Now, how many treatments would it take on average to feel better?
It depends on what you're treating. Usually, the more acute or recent onset, the shorter your duration of treatment. The more chronic, the more treatments you would need. The beauty of acupuncture is that it's cumulative, which means it builds on itself. So even if you have a chronic condition, we find that the effects of treatment last longer and get stronger the more treatments you have.
Can you give us an example of some type of like a migraine? Would that be something that would be helped?
Yes, so migraines, a lot of people find after we put the needles in, if they're having a migraine at that moment, that it's reduced by 50% to even completely gone. But most migraine sufferers, the migraines happen cyclically. It could be depending on what they ate, it could be with the weather, the change of seasons, other things going on in their body. A lot of people have them twice a week, every week, or 2 times a month, pretty much like clockwork. So in that case, we need to treat regularly in order to break that habit. So for migraines, I usually tell people to give me a few months, maybe once a week of treatment, and that should be enough to break that habit. Depending on how severe the headaches are, how long they've had them for, it might take more treatment or less. Everybody responds to acupuncture a little bit differently, and they have different factors that, of course, exacerbate their condition.
Now, are there side effects to acupuncture?
Luckily, there are very few. Sometimes people might have a little bit of tenderness at the site that the needle was inserted. There can be a little bit of bleeding. Luckily, we usually just need to press with a cotton ball. It's just a drop of blood. The needles are very thin. They're almost like the size of a human hair. And so, although they're very sharp, the blood vessels, for the most part, move out of the way. So if we do hit a blood vessel, it's a very small surface capillary that'll only have a drop or so of blood. We don't have to put a Band-Aid on it, and most people the first time are surprised they're looking at their body for the holes and they can't see anything. It's not like getting a shot where you have to put a Band-Aid on and you're going to be sore for much longer afterwards.
How far in do the needles go?
It depends. It also depends on the style of acupuncture, but for the Chinese acupuncture that I practice, they go in anywhere from 1/8 of an inch up to even 1.5 inches on some of the meatier areas, like if I was going to do someone on their lower leg, a really larger person, I could go in maybe 1.5 inches, but for the most part, they're not very deep.
Now, you operate your own business.
Yes.
How do you operate an acupuncture business?
Most acupuncturists in the United States are self-employed, about 91%. There are, luckily, more and more jobs for acupuncturists as hospitals are finding that it's a very effective adjunct to what they're providing for their patients. But for the most part, once you graduate from acupuncture school, you will need to find a clinic of your own or go into it with another person. Some acupuncturists like to share offices with chiropractors or physical therapists or massage therapists. And basically you set out your shingle and start doing the good work.
Now, do you work with Western medicines? You mentioned hospitals.
Absolutely. Acupuncture works phenomenally in conjunction with Western medicine. And we find that it's especially helpful for chronic cases. A lot of times with chronic pain, for example, or chronic digestive problems, chronic asthma, Western medicine doesn't have that many effective therapies. They can suppress or mask the symptoms, but they can't really get to the underlying disharmony that's causing the problem. So in that case, acupuncture works well to support the body, bring the body back into balance, and to help the body heal itself. So it works very well in conjunction with Western medicine, with chiropractic, with massage, with physical therapy.
Is it something that insurance would pay for?
Some insurers in the state of Connecticut will, but not too many. Again, that goes state by state. In California, there's a lot of insurers that will cover it. If your insurer will cover it, then it's quite easy to get reimbursed. There are a lot of different ways to go about charging and billing so that you're using the right appropriate diagnostic codes. And one thing that we'll talk about in a little bit is the subject of community acupuncture, which has a sliding scale. So even if your insurer doesn't cover acupuncture, you're able to hopefully afford something that's a little more easy on the budget.
Well, Carrie, thank you. We will take a short break, and when we return, Carrie will demonstrate the therapy of acupuncture.
Could you dedicate yourself to a worthy cause? Could you go the distance to keep a child healthy? Could you travel to the other side of the world to help eliminate polio? Could you? A Rotary member could. We're dedicated to connecting children with vaccinations and ending polio worldwide. All it takes is one person to make a difference, like me. like you. Could you help change the world? Will you? Rotary. Humanity in motion.
Who says you can't teach an old dog new tricks? Maybe you should go to your shelter and get a mature dog who will make your blues disappear. How's that for tricks? I got picked. Wow.
Welcome back. Rejoining me is Carrie Sawtell, and she has brought Seal with her to assist in a demonstration of acupuncture. Carrie, you mentioned community acupuncture. What do you mean by that?
So community acupuncture was developed about 5 years ago by a woman in Portland, Oregon. She wanted to make acupuncture more affordable and accessible to the members of her community. And now there's about 200 community acupuncture clinics located in the United States. Most of us are members of an organization called the People's Organization of Community Acupuncture, or POCA. And in order to become a member of POCA, the clinic needs to meet a few basic requirements. First of all, instead of providing treatment for a patient in his or her own private treatment room, it's done in a community setting. So maybe 1 or 2 large rooms with recliners such as this. And we choose points below the elbows, below the knees, and on the head, so that the patient just needs to roll up their shirt sleeves, roll up their pant legs, and we can, with those points, actually affect the entire body, whether it's internal disorders, back pain, or local pain in those areas. The other criteria is that the clinics must have a sliding scale. Right now, it's between $15 and $50, with the low end of the scale no higher than $20. So in my clinic, for example, I have a sliding scale from $15 to $35. Everybody pays whatever they can afford, and there's no income verification required. You get your own customized, individualized treatment just for you. But we have a high volume, low cost model, which means that you can pay whatever it is you can afford to pay. The treatment doesn't depend on what you pay. Hopefully you can afford to come as many times as you need to in order to get better and stay better.
Now, is there something that the patient needs to do to prepare for a treatment?
Yes, we prefer if you don't come overly full or overly hungry. So a small meal or a snack about an hour or 2 prior to coming into the treatment is fine. Of course, in a community clinic, you need to wear clothes that you can easily roll up. No skinny jeans, much to some people's chagrin, and basically come with enough time so that you can relax. Acupuncture is incredibly relaxing. A lot of people end up falling asleep, so if you have to rush from one place to another, you won't necessarily get the full benefits of treatment.
This will be a quick demonstration, but how much time should someone budget?
Well, I recommend a half an hour once the needles are in. If you have more time, that's better. 45 minutes to an hour is great. Some patients, especially those that are in a lot of pain, tend to stay longer. I've had someone stay as long as 3.5 hours with the needles in. Now, that's on the extreme end. Most people stay between a half an hour to an hour. You can still get the full benefits of treatment with a half an hour. It really depends on how your body responds, how quickly you relax, and how quickly you feel the effects of acupuncture. Some people feel it instantaneously. Some people, it takes a few minutes for them to settle down and really feel what's going on.
Thank you, Gary. Would you like to begin your demonstration?
Absolutely. So Seal today is going to show us a few of the points on the arms and maybe on the legs. So there are a number of points all along the body, but we find that the most important points are below the elbows and below the knees. These points are likened to water flowing in a river, and the yang meridians, you've probably heard of the term yin and yang. The yang meridians start on the tip of the finger, and the first point is called the well, and it moves up to the spring, to the stream, and then up to the sea at the elbow. And this is a good way for describing the flow of energy along these points. And so by needling these points, we can affect the whole body. So the first point I'm going to do is a point on the elbow. And I'll show you one of the acupuncture needles because most people are impressed at how tiny it is.
That's hard to see.
In fact, I think you probably can't see it. So this point is used quite commonly in Chinese medicine. It's great for lowering blood pressure, and it's also fantastic if you have a cold. And so basically, we just tap the needle in and then get it to the right depth.
Now, what was that little piece you used to guide it?
This is a guide tube, and it's used for easy insertion.
Oh. And there's no pain to this needle going in or anything?
Now, some people might find a little sensation when the needle is inserted. Some points might be more sensitive than others. The good news is if you do feel that little bit of a pinprick, it calms right down. Some of the needles, like I mentioned before, maybe on the lower leg will go a little deeper. And once we get that needle dipping into that river, you might feel something going on. We call that getting the chi. And that sensation usually subsides pretty quickly too. And that's not an uncomfortable sensation, but it is a sensation.
Now, what's the chi?
The chi. So it's been translated into English as energy. But I like to think of it as blood flow, as oxygenated blood, because that's really what we're doing. We're getting the blood moving in the body. So let's say Seal had back pain, and I was going to choose a point on her hand that's very effective for back pain. What it's doing is drawing the blood flow to that area of her body. That's what brings the white blood cells, your anti-inflammatory factors, everything that's going to get rid of everything that's built up in that area and promote the healing.
So the river is opening up?
Exactly. We're basically removing what we call stagnation from the channels and opening it up so that the body can heal itself. We find for most conditions, the body has everything it needs to do the healing. It just gets stuck in that habit like I was talking about before. So we're gently reminding the body what's going wrong, what it needs to fix. It puts its attention to that area and it heals itself.
Now, is there an average number of needles you would insert in a session? Or?
It depends, again, on the style of acupuncture. Some people can use as few as 4, others can use 30 plus. They're inserted very quickly, and because it's relatively painless, it can take, even with 30 needles, a minute to put them all in. It's a very quick procedure. But it does depend on what you have going on, if I'm going to be treating one condition or 10, and again, the type of practitioner and what they prefer.
Now, do you interview the patient before the procedure?
Absolutely. We take a full medical history. We go over their medications, any past illnesses, surgeries. We talk in depth about what conditions they want treated, and then put together a treatment plan. In some cases, depending on the severity of what's going on, it's better to focus on one thing at a time. In other cases, if you have a number of chronic complaints, we can focus on more than one thing at a time.
So you can do more than one?
Yes, absolutely. It depends on how those individual complaints work with each other. So if you have, let's say, shoulder pain and elbow pain, very easy to do together. But if you have shoulder pain and hip pain and back pain and toe pain and ankle pain, maybe we could work on all of those together, but it would dilute the treatment a little bit. So in that case, I would talk to the patient about their expectations. If there's something that's really pressing, they have a splitting headache they want to get rid of right away. If maybe their toe acts up once every few months and isn't as important, we would focus on those few things that are most important and then move on to the others.
Now, is the acupuncture treatment something that will cure your ailment?
It depends on what the ailment is, and it depends on the definition of cure. For people, let's say you throw out your back, we can put some needles in and you'll be walking home right out the door. But for chronic pain, if you have, let's say, severe osteoarthritis in your knee, no, it's not going to make the arthritis go away. We have found, in fact, there was a recent study done showing that acupuncture is very effective for osteoarthritis of the knee, and actually they're saying now it's better than having knee replacements in some instances. Yeah. So it's not going to cure the arthritis, but it can bring down your pain, improve your quality of life, and in many cases prevent you from having to have surgery.
Now the needle you inserted in seal, what is that intended to treat?
So this point in particular is good for high blood pressure. It's helpful if you catch a cold to reduce a fever. I use this point a lot because it's also helpful for inflammation. So I use it in adjunct to other points when I'm treating pain.
So is it just the hands and the arms and the legs and the feet that you're treating?
Yes, although sometimes we might do a point at the throat, or if someone has a certain condition and they happen to have a foot can move up, we can do a shoulder. It depends on what's being treated and what's comfortable for the patient. The good news is, let's say Seal has a broken arm and I can't needle this arm. I can needle the other arm. I can needle points on her legs, on her feet, on her head, all that have the same function and get to the same part of the body.
So there's more than one way?
There is more than, in fact, there's many ways, but yes, there's always more than one way. So sometimes people will just have an area of the body they don't feel like having needled. Maybe it's the top of the head, maybe it's their feet. They're just a little bit ticklish. They don't want their feet being needled. That's fine, we can work around it.
Carrie and Seal, thank you for joining us today and educating all of us about the career path of acupuncture and how it is more than just a job. Like so many health professions, it is a healing art. Thanks to all of you for watching this program. We hope that it may have given you a new idea about a career path. As always, we here at Service Above Self encourage you to find a worthy cause and lend a helping hand. Until next time.